Welcome to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Ian, and once again I'm joined by Dr. Clifford Yudelman from OptiSmile, and we are about to take another deep dive into the world of dental care from a consumer's perspective. So if you're looking to brighten your smile or just protect your wallet, we've got you covered with practical advice and the latest insights. So stick around with us. And today we are discussing the link between athletes and oral health, how your teeth can actually affect your performance. I mean, we all recently watched the Comrades. I'm actually surprised you didn't take part in the Comrades, Dr. Yudelman.
And I hate running. I'm not a runner. Yeah, I've got a few running jokes. One of them, I don't know if you're a runner, or maybe I might upset a few listeners. It's like, yeah, I'm a cyclist. So, whenever you see people cycling, they always seem to have a bit of a smile on their face, and unless they're going up a very steep hill. But runners always, like, they most of the time they look quite grim. And the story is, why do people run so early in the morning when you know your day can't get any worse?
That's funny. I always say, if you see me running, then you must start running as well, because then something's chasing us. That's the only way.
There's the other one, the T-shirt I once saw on the front, it says, "I'm a bomb disposal expert." On the back, it says, "If you see me running, try to keep up."
Brilliant. I love it. So obviously there's a link between the two, and I want to start by asking you, Dr. Clifford Yudelman, how does chronic gum disease measurably affect athletes' performance or athletic performance?
Oh, that's a great question to start off with. So if you've got ongoing gum disease or gum inflammation, there are these things called cytokines or cytokines, depending on which country you're in. They got funny names like IL-6 or TNF- like a little funny A. And these can raise systemic fatigue levels and slow muscle recovery. And low-grade infection can actually push up your core temperature and make your heart rate higher during exertion. And this could also take down your VO2 max, which any athletes listening will know about that. It can actually affect your VO2 max. And athletes with untreated gum disease always report a more or a greater perceived exertion and are statistically more prone to overtraining injuries. It's funny what people research, but this is, I lived in Australia for 12 years, and Australia funds, they do a lot of studies for their Olympic athletes. They do a lot of scientific studies, and they put a huge amount of money into this. And so a lot of these studies come out of Australia.
And then you get all these popular sports drinks. Are they ultimately protective or actually harmful to your teeth?
Yeah, so going on from last week's one about hydration, the sugar acid combination with a pH that is often below 3.5. Remember, we said 5.5 means it's bad for your teeth. This actually fuels those bacteria, the strep mutans or streptococcus mutans, which is the main bacteria that initiates cavities. And this can dissolve your enamel in as little as 15 minutes. If you sip on these continuously while training, it prolongs the enamel exposure. Whereas if you finish off a bottle quickly, or you eat you have a gel with electrolytes, and then you drink plain water, that's a good hack. A lot of the gels now have electrolytes. You don't have to have a big bottle of water. There's also isotonic drinks without added citric acid or xylitol, or with xylitol instead of sugar, and they gentler choices for your teeth. If you're training more than 90 minutes, when I used to do a lot of endurance cycle training, we always just used to drink water unless we were going out for 4 or 5 hours.
And why are endurance athletes more prone to enamel erosion than the general public?
So it's very hard to breathe through your nose when you're running at pace. So there's obviously a lot of mouth breathing, which dries the saliva, and that strips away the natural buffering that your saliva buffers or neutralizes any acid. So now you're starting with a dry mouth, and then long bouts of exercise can depress your salivary flow by up to 50% and extends this acid attack on your teeth, or how long the acid has to attack your teeth. And then frequent intake of these carb gels and acidic drinks form a triple hit of sugar, acid, and dehydration. So, yeah, we get a lot of very healthy people, triathletes, especially triathlons are very popular in Cape Town, and you've got your comrades, and there's so many people out running and long distance cycling, and these people come in, they're super healthy and they're ripped and fit and everything, and they open their mouths and there's cavities everywhere and bad breath and gum disease. So, we're trying to get the message out there to save your money and save your teeth while getting healthy.
And does poor oral health really influence your muscle recovery times as well?
So, yeah, there are studies that show that bacterial endotoxins actually get into your bloodstream via bleeding gums, and it causes a low-level systemic inflammation. So something called a CRP, or C-reactive protein, can be raised from gum disease, and this can delay collagen synthesis or tissue repair. So you need to make collagen to repair your joints or any ligaments that get damaged or torn in training. And cleaning up oral infection has been shown to actually shorten that DOM, or delayed onset muscle soreness, and improve sleep quality. It's quite amazing when I was doing the research for this podcast that what I found. Yeah.
And then I also want to ask you, Dr. Yudelman, should non-contact athletes bother with mouth guards?
That's a great question. My stepson is aspiring pro. He's looking to become a world champion. He's won 3 fights. He's off to train in Vegas, and we made him a really super duper professional mouth guard using a 3D digital scan and printed models. And people always think of boxing and some of these contact sports, needing mouth guards, but funnily enough, they all wear mouth guards. In fact, you can't go in the ring without a mouth guard. But lifting weights has become very popular, and people clench during weightlifting or even during sprinting, and you can generate forces way higher than you do when you chew, over 500 newtons, which is a huge amount of force, and that can cause microfractures. You can get a lightweight mouth guard for weightlifting or even for sprinting, almost like a retainer, just a slightly thicker one. Obviously, if you've got braces on, you want to protect your teeth with a custom mouth guard. And then a properly fitted mouth guard stabilizes your TMJ, your jaw joint, and it can improve, apparently, according to research, can improve neuromuscular alignment and power output. So, if you do deadlifting, something like that, try, instead of clenching your teeth together, get a nice mouth guard made, and then see if you can perhaps even lift heavier weights.
And Dr. Yudelman, what dental problems should athletes screen for at 6 monthly checkups? What would you say?
So a lot of people actually don't need checkups every 6 months, but I'm pleased you mentioned that, because with athletes, we definitely need to see them every 6 months, because they could change one of their electrolytes or their gels or start doing something different. And I've seen patients in as little as 6 to 12 months get huge amounts of erosion on their teeth. We use loupes, or 3 of our rooms, we've got microscopes, so we can see erosion early on, where filling on a tooth doesn't get eroded, and then the tooth is sort of melting away, and the filling looks like it's popping out, but in fact the tooth is melting away, especially on the palatal, on the tongue side of your upper teeth and behind your upper incisors. Our practice is right next to a gym, and we've had a number of personal trainers from the gym come in with this particular problem. And then there's something called branched short chain amino acids, and the word acid is in there. So I don't know the exact pH, but I know it's got to be acidic, and they sip on these during workouts, and some of these guys can lift weights for 2, 3, 4 hours. They don't look like that for nothing. They put a lot of effort in there. And micro cracks, craze lines, which are those little white sort of cracks you see through your front teeth, that can be caused by repetitive clenching or from impact. Look, I think that's enough. I think just come in every 6 months and we'll look after you.
And then, Dr. Yudelman, can saliva testing guide an athlete's nutrition or training strategy?
Yeah, at the professional level, one can get into that, like the Australian Olympic Committee and some of these very high-end athletic endeavors on a world level. There's things that you can do. We used to do a lot of saliva testing at one point where you get people to spit in a little cup and then you can check the buffering and the pH. There may be some dentists that still do that. I don't know if it's as popular. There's ways that you can actually check the cortisol in your saliva and track systemic stress and help fine-tune recovery cycles. I've never really heard of anyone doing that, but in my research, I found out about that. And then there's other ways to measure things like lactoferrin and immunoglobulin A, which tells you how your immune system is before competitions. But this is really at a super duper level, world athletic stage.
And when it comes to teeth whitening, is it safe to whiten your teeth during a competitive season?
Yeah, so professional teeth whitening gels are pH neutral. They can actually strengthen your teeth when they're used under guidance. I would definitely not whiten my teeth at a beauty salon or with something that you buy off the internet or over the counter. We did, if I remember right, I think 4 or 5 podcasts about teeth whitening. So if you're interested, go back and look at that. So professional teeth whitening definitely doesn't damage or weaken the enamel. If you're going to do an in-chair session, we use something called Flash from Germany. Very rare we cause any sensitivity, but if you're getting some of the other more popular in-chair or 1-hour whitenings, I can't guarantee that you're not going to have zingers or pain. We get a lot of complaints from people that have gone elsewhere and their eyes tear up when they talk about whitening. They're like, oh, I'll never do that again. They talk about having shooting pains or zingers for days and days. So just if you're going to run a Comrades or something, don't go and get your teeth whitened the day before, because you could be in trouble there. Unless, of course, here's a little plug for OptiSmile. Unless you come to OptiSmile, we'll sort you out. And like I said, don't use over-the-counter trays or strips, things like that, because you're looking for trouble.
And then let's talk about the gels, the high-carb gels. Do they also damage your teeth more than the standard sports drinks?
Yeah, so in doing my research, obviously these things are sticky and they get into crevices, and then there's also bars as well. When we're cycling, we used to do gels and bars, and they can have raisins and dates and all kinds of nuts in them. They get stuck in your teeth. But they usually have a combination of glucose and then maltodextrin, and maltodextrin converts rapidly into this acid-producing glucose. So just because it doesn't contain sucrose or glucose, if it's got maltodextrin, it converts very quickly. And then having a swig of plain water, as I mentioned before, after a gel or a bar or after a electrolyte drink, something like that. And something that I like to do when I'm cycling is I keep some Orbit Professional, which is basically xylitol gum, and you chew on that for 10 minutes. I don't know when you're running, I don't know how popular chewing gum is when you're running, but definitely with cycling, I love to chew some gum when I'm going out on the ride. And then if I stop for a coffee somewhere, as one does, have a piece of gum for 10, 15 minutes on the way back. So if I have a lovely chocolate croissant or something, it's not sitting in my teeth for the next couple of hours. And I think that's some good tips right there.
And then a final tip from you, Dr. Yudelman, for today's podcast. What would you say is the single best oral health habit that every athlete should adopt?
So we mentioned tooth mousse, or in some places it's also called MI paste. They make one with a little bit of fluoride in it, and I think putting that in a night guard or like an Invisalign type of retainer or bleaching tray for 10-15 minutes before you go to bed, or even just rubbing some of it on your teeth, swishing it around and spitting it out and leaving it on your teeth, that will definitely protect your teeth, because obviously your gels and bars and all of that are going to take precedence. A lot of people think I'll worry about my teeth when I get older, and given that most athletes are in the younger age group. And then a custom 3D printed mouth guard, like I mentioned, that would definitely help to mitigate clenching forces and accidental impacts, and finish every workout by rinsing out with some plain water, and then rehydrate fully within 30 minutes to restore your saliva flow.
And that wraps up another very interesting podcast, Dr. Yudelman. Thank you so much for your time and for sharing all your knowledge with us. We really appreciate it.
No, it's a pleasure, and thank you. And I just want to say to any of our listeners on the podcast, at OptiSmile, we have online booking, and the main option is to book a 1.5 hour fully digital exam with x-rays and 3D scans, etc., and you get a full report. But for people that don't live in the area or thinking about coming to see us, or just somebody who wants to get in touch with me, feel free to book we book a 30-minute slot. It's a free video consult. We use Google Meet, which is just like Zoom. So if there are any athletes out there that would like some personalized, some answers answered personally, from myself or one of my associates, book one of those free video consultations, and looking forward to hearing from you.
Okay, and that's it for another OptiSmile Save Your Money, Save Your Teeth. Apparently next week we're going to be talking about toothpastes and debunk some myths and facts. Is that correct, Dr. Yudelman?
Yeah, there's a big problem with these fluoride-free toothpastes. So we're going to be talking about fluoride versus non-fluoride toothpaste. So stand by for that.
Thank you so much. That's it for today's episode, and also a big thank you to our listeners for joining us. And remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. Subscribe to our podcast for more enlightening discussions, and join us again next week as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.